Alrighty, so to start with, this video is probably going to massage should last around about 15 to 20 minutes. We're going to go through the anterior leg to start with. We're looking at anatomy down here. Obviously you've got your tibialis anterior on top of the shin, just on the lateral side, and then on the back, which you can still get in a supine position, you've got your gastrocnemius installatus just beneath it. As we move up to the quads, you've got rec fem in the middle, vastus medialis and lateralis on its outsides, and then you've got your ITB that runs almost on top of the vastus lateralis. You'll also find from this position that you're able to feel and massage parts of the adductors, sartorius gracilis, as well as generally the main one would be adductor magnus. As we move up, we're also going to work through the anterior arm, all through the arm. So starting distally, we've obviously got your forearm flexors and extensors. Then we're moving up into your biceps, and then anterior deltoid. From there, we'll move across into the chest. The main two muscles are your pec minor, which sits underneath, and then your pec major, which is a big one that we all know that sits on top. Into the neck, we've got your sternocleidomastoid and then scalenes, but you'll also get portions of your upper trap that you'll be able to work through in a supine-based massage. In terms of precautions for these areas, a couple of things to be careful of. Obviously, with the lower leg, we want to watch for any contusions or possible issues of varicose veins or anything that may suggest an issue that we need to refer out to. We also want to be careful in terms of where we put our hands as we work towards the inner thigh, making sure we don't encroach on an area that is uncomfortable for the patient. In terms of the arm, we want to be very careful to avoid a couple areas which are hypervascularized and have a lot of arteries and nerves close to the surface, such as the median brachion as well as the cubital fossa. Again, we want to be careful of any surface wounds that may pose a potential precaution to massage. In terms of the chest, the main one, we want to be very careful, particularly with females with breast tissue. Obviously we want to keep it out of the way. We want to be careful with our draping, as well as ensuring that the patient feels comfortable in this and feeling like their personal space has been invaded. As I say, this is particularly important for females. In terms of the neck, normally, obviously we want people to take off jewellery if they've got it. Unfortunately, Chris has a necklace that can't be removed, so we'll work around that as best as we can. You also want to be very careful in terms of encroaching too neatly on the anterior aspect of the neck, which gets into an area that's extremely uncomfortable. So we're going to stick very much to the lateral side, making sure that we're staying in contact with the SCM and back under to the upper traps. Again, we want to be careful with our pressure, and that's something we need to maintain awareness of throughout the entire massage, and keep communicating with the patient to make sure that they're comfortable, that the pressure's okay and that everything's alright. In terms of the stances that we're going to use today, the two stances are a horse stance, which is used to work in the transverse process, so across the body, which we'll be using through the anterior thigh, parts of knee in the arm, as well as particularly up around the neck. Will be mainly in a horse stance, which is like a quarter squat, essentially. The other stance which we'll use to work longitudinally, so up and down the body, is the lunge stance. So essentially 1 foot in front of the other, even weight distribution, just making it nice and comfortable for ourselves as practitioners, as well as enabling us to move smoothly up and down the patient's body. So what we'll do is we'll get started with the anterior leg. If at any time you're feeling uncomfortable, Chris, let me know. Same with the pressure. We'll try and keep it reasonably gentle. The aim is just to warm the area and stimulate blood flow through the defleurage. We'll work a little bit deeper with petrissage-based techniques, as well as some friction techniques as well. So what I'll actually do before we start is I'll just run through what we're actually going to do. So with the anterior leg, we're going to start with defleurage to the calf and thigh, just to spread the oil and warm the area. We'll then spend a little bit more time in the calf, again further warming the area up, and then we'll probably use between 15 to 20 strokes of effleurage. We're then going to move on to the calf and we use a friction technique to split the bellies and come back. After we've done this, we're going to move to the anterior thigh. Again, we're starting with effleurage, probably use an alternate hand glide to start with, and then we'll use a reinforced hand glide as the area starts to warm up to get a little bit deeper before we move into the petrissage. So petrissage is going to start with kneading, then we're going to move to ringing. We'll probably use about 10 to 15 of each of these, depending on how we're going with time and how it's all flowing together. After that, we're just going to use a friction technique on the ITB, so just gliding up the outside, just trying to sort of release some of the pressure or more just to stimulate the area so that it's nice and warm and blood's flowing so that the patient feels nice and relaxed. In terms of after we've done the anterior leg, we're going to move up into the anterior arm, into the arm. We're going to start looking at the upper arm and deltoid effleurage, about 10 to 15 strokes. That are then going to move down to the forearm, again around about 10, and then we're just going to go through the entire arm. So we're spreading the oil, 10 strokes approximately of the entire arm, just to really start warming, making sure the area is nice and warm so that we can start working into some petrissage, which will start kneading through the anterior delt and parts of the bicep, approximately 15 to 20 depending on how it's all flowing. A friction technique, palm heel friction along bicep. Then we're going to move into kneading the flexors and extensors, about 10 on each, and then effleuraging the entire arm as in transition up towards the chest. A little bit of kneading on the deltoid, and we're going to go to the chest. We're going to start with effleurage on both sides at once to spread the oil. After this, we're going to focus on one side in particular, a hand after hand technique, and then a reinforced hand, very similar to what we did on the anterior thigh. Start with a lighter technique and slowly work a little bit deeper with effleurage, and then we might do a few circular friction technique before using effleurage to transition to the other side, in which we'll repeat the process. Once we've done the chest, we're then going to move up into the neck area. We'll effleurage both sides, working through the upper traps and into the SEM and back to the occipitals. Approximately 12 to 15 strokes or so. We're then going to turn the head slightly to the side and use a finger glide through the SEM, and then a little bit of cross friction down the base. After this, we'll go back to effleurage, use this to transition across to the other side, which will repeat the process. Alrighty, you ready, Chris? Okay. So obviously we need to undrape the lower limb to start with. We've got two towels here. The first towel wasn't quite big enough to lengthen, so we just got another one to cover his foot. So we'll just pull that one to the side to start with. And then with this, we're just going to pull it slightly so that the knee's exposed. Reaching up, we're just going to go 2 tucks into the undies. Just going to get you to lift your leg. Tuck this one in here. You can see we've got a pillow under his knees for support. Obviously this leg's exposed a little bit more, so just going to cover that up with a towel. And starting on the calf, so to speak, and the knee slightly. Just going to spread the oil. Just relaxing back down. Spreading the oil right up over the calf. So just get you to bend this thing slightly. Splitting the bellies, coming up, and that side. Is that pressure alright?
Yeah, it's good.
back into some effleurage. Relaxing back down. Now working up into the quads, so hand up to hand. Reinforced hand, working a little bit deeper, but not too deep. That pressure's alright.
Yeah, it's good.
And into petrissage. And once we've done the petrissage, we're just going to work an alternate hand. It's working across the quads and through the adductors. Hook and pull. Nice and warm now. And then just going through the ITP, my pressure's alright.
Yeah, it's good.
Probably can give it out of 10.
4 or 5, yeah.
Yeah, good. And just finishing off with some effleurage. Going to walk back around and undrape. So just pulling it out. Back across. Cover up both legs again. And then we're just going to finish off with some embodiment. So it's nice and soft. Bit of hacking. Alright, I'm just going to get you to just unhook this. What I get you to do, Chris, is just to bring your arms on the outside of the towel for me. Good. Just going to fold that down. Just going to get you to roll to your right for me. Just going to tuck this in so it doesn't move. And rolling back across the left. Good. Down, and arms just down like side. And starting with the effleurage, just working on the upper arm. Working in the forearm. A little bit more warmth there, a little bit of kneading as well. some kneading of the biceps. Pressure's alright?
Yeah.
With the kneading in through the anterior deltoid. Heel through the bicep. Left large, and then just kneading through forearm extensors. If you rotate the hand, you can get into extensors. Through the wrist. And you can come up. Hands. Just working through the palms, up into the fingers. Back down, and then we're just going to use an entire effleurage. A little bit of kneading through the delts. We're going to move on to the chest. So spreading oil to start with, the effleurage. And then reinforced hand, just working a little bit deeper, not too deep though. What's that pressure like, Chris?
About 4 or 5.
Working in some little circles. Same process on the other side. That pressure's still about a 4 out of 10. And again, just some circular frictions. Again, not too deep, just enough to move. Next, we're going to work up into the neck. Starting to get a nice little lock into the neck now. Just going to get you to turn your head slightly to the side. That's the pressure.
That's good.
Okay, a little bit of cross friction in this here. Snap throw, just finish off. Turn your head to the other side. Let's get an effleurage to start with. A little bit of friction down the bottom, not too much. Bring it to neutral. Can work a little bit up into the subaccipitals. So just with a basic line shampoo. Good. How are you feeling?
Yeah, good. Nice one.
Have you noticed any changes?
Yeah, sort of feel nice. It feels a little bit freer.
Awesome. Do you have any questions about today's treatment, or
Is there anything else to do afterwards? Like,
just make sure you drink plenty of water this afternoon? Take it nice and easy. If you've got a chance, it'd be perfect to have a nap, depending on what you're doing. Just make sure you drink plenty of water throughout the rest of the day. Alright, so we're just going to get up nice and easy, just coming to a seated position. Good. Feeling okay?
yep, feel good.
Alrighty, I'll leave the room now and feel free to get changed when you're ready, and then I'll meet you outside.
Awesome.